Bioavailability is at degree which drug or substances reach the circulation and become available to target organ or tissue. Pharmacokinetic is movement of drug within a body. Pharmacokinetic have four process, which is absorption, distribution, metabolism and excretion. First, orang tu dia akan makan ubat, and then dia akan berlakunya absorption dalam badan. Lepas tu dia akan distribute throughout the body. Lepas tu berlakunya metabolism di mana fat soluble and water soluble akan excrete dan berlakunya proses excretion. Lepas tu example of food and drug interaction iaitu grapefruit, caffeine, warfarin and alcohol. Warfarin ialah anticoagulant. Kalau dia akan increase the risk of the bleeding. Substance that interact with the drug that contains in a grapefruit, which is first antihypertensive, lipid lowering drug and anti-anxiety. While warfarin prevent the conversion of the vitamin K to the usable form. Warfarin ni adalah example of food and drug interaction. If vitamin K is usable form, it will allow production of more clotting factor that will affect drug effectiveness. Sebab warfarin ni adalah dadah. Dia adalah anticoagulant. Kalau kita ambil dia, so vitamin K dalam badan ni adalah coagulation. Kalau kita ambil warfarin ni, kalau kita ambil warfarin ni, so vitamin K dalam badan kita useful. Tak boleh digunakan lagi. What nutrition in our body that will give effect when we consume carbamazepine drug? Give 3 of them: biotin, folic and vitamin D. Drug absorption process. How drug can change GI environment during absorption? The process is firstly proton pump to the inhibitor. Then H2O receptor antagonist inhibit gastric acid secretion. If the acid secretion high gastric pH, cimetidine low intrinsic factor secretion impair B12 absorption. If the pH increase, they akan impair the absorption of the calcium, iron, zinc, folic acid and beta carotene. What is the pharmacodynamic? Pharmacodynamic ialah biochemical and physiological effect of the drugs and mechanism of the drug action. Pharmacodynamic ada dua, iaitu action dengan mechanism of actions. Benefit low food drug interaction. Optimal nutritional status preserved, accident and injuries avoided, disease complication minimized, the cost of health care service is reduced. Thank you.